Hello. Edutainment Studios and Access Healthcare welcome you to Depression, Learning to Control. This module is part 2 of a 5-part series. Everyone feels sad or low sometimes, but these feelings usually pass with a little time. Depression is a mood disorder that causes distressing symptoms that can affect how you feel, think, and handle daily activities such as sleeping, eating, or working. Symptoms of depression can be different for everyone. If you have any of the following symptoms, you should talk to your doctor as soon as you can. Feelings of hopelessness and/or helplessness are common in those who are clinically depressed. They're also some of the most frustrating feelings that depressed individuals experience. Feelings of helplessness reflect a negative view of the self. Depressed individuals view themselves more negatively, their self-esteem suffers, and they have little or no self-confidence. In an Eeyore-like pessimistic way, the depressed person can't help feeling that everything is wrong and it's his or her fault. It's a hallmark sign of major depression. In mild depression, the feelings are similar but less extreme. Feeling agitated, restless, or even violent is also a symptom of depression. Your tolerance level is low, your temper short, and everything and everyone gets on your nerves. Feeling overwhelmed, fatigued, or stressed are other symptoms. You may feel extremely tired or think more slowly. Daily routines and tasks may seem too hard to manage. Loss of interest in hobbies or games you usually enjoy may be yet another symptom of depression. You may have little or no desire to eat or partake in sexual activities. It could be tough to focus. You may have trouble remembering details. It might seem overwhelming to make a decision, whether it's big or small. Changes in the way you sleep can also occur. You may wake up too early or have trouble falling asleep. The opposite can also happen. You may sleep much longer than usual. You may overeat or not feel hungry at all. Depression often leads to weight gain or weight loss due to changes in appetite. You may have headaches, cramps, an upset stomach, or digestive problems, or just generalized aches and pains. Although most people who are depressed do not kill themselves, untreated depression can increase the risk of possible suicide. It's not uncommon for depressed individuals to have thoughts about suicide, whether or not they intend to act on these thoughts. Severely depressed people often do not have the energy to harm themselves, but it's when their depression lifts and they gain increased energy that they may be more likely to attempt suicide. This has to be watched closely by family and medical personnel once treatment starts. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 5-part series on depression. Please let us know how we did by completing the survey. If you have any suggestions or questions, please send them to us via the survey and come back for part 3.